Kenya Red Cross Society represents how the Red Cross and Red Crescent movement work with a network of volunteers, especially in humanitarian contexts in communities where there is existence of vulnerabilities, crises, hazards, risks, conflicts and diseases. Volunteerism has proven to be a powerful and cross-cutting means of implementation even within the society. COVID-19 is yet another extraordinary disaster that has tested the resilience of the society's volunteers, who had to put their lives on the front line in helping the country combat the deadly disease.
And they've really played a critical role in ensuring that our communities understand what is COVID-19 and what are the measures that we need to take to ensure that you're safe.
When COVID-19 cases in the country shot up and community transmission became alarming, stakeholders like Kenya Red Cross Society had to intervene through various spaces, from psychosocial support, food distribution, community sensitization and capacity building, among others.
We wake up early as 4 so that we can reach here 5:30 exactly. The mall begins its operation at 5:30 a.m. and closes its operation to 7:30 p.m. On a busy day, we screen over 8,000 people.
We have this fantastic energy with our volunteers. If you're at a distribution, you will not want to miss another one.
So we had a few cases of volunteers who got infected, but through our leadership and our psychosocial support teams, the volunteers were well, and we ensured every day we give them moral support and also their families to just keep them in check that we are in this together.
We had the fear, but we had to do it. So we also had where our team carried a suspected case which we didn't know, of which some of our members went to the quarantine, but it was a suspected case which it turned to be negative.
During this time of the pandemic, the society was overwhelmed at the number of requests from members of the public wanting to extend their helping hands to those in need as volunteers.
Some are even struggling, but they still want to come and support. And I think that is one of the things that made us very proud. Because humanity is when you see somebody helping, even when they also need help themselves.
They have also built a solid trust between themselves and communities they have worked with over the years, such that they are able to reach even the most inaccessible groups in the society.
And actually what we learned is this group of people feel ignored and feel neglected, and they have a lot of misconceptions and lack of correct information about corona. So what we've been doing is demystifying the misconception, giving them the correct information.
Every year we celebrate and recognize the efforts of our volunteers. This year we are acknowledging their efforts and we have one category, for instance, we call COVID-19 response, just to ensure we recognize the exemplary efforts in ensuring that our communities are safe, are sensitized, and at least we've managed to mitigate COVID, spreading.
They say volunteers do not necessarily have the time, they just have the heart. You make a living by what you get. You make a life by what you give.